standing at a juncture where we're looking at a very interesting intersection between health and technology, I have to ask you, what do you make of the way in which technology has impacted the healthcare sector to begin with? And also, it's only natural that it also trickles down to the individual level in terms of people relying on AI, for example, for quick medical advice. What's your view on that?
So you have to appreciate, this is the third revolution.
Yeah.
After internet and digital, now AI, of course. But what is more powerful for the human point of view and health point of view is the coupling of genome sequencing with the power of AI. So what does it do for us? Genome sequencing, which has actually democratized the whole world, because today the cost of doing a person's full genome sequence is 10,000 rupees. It's come down from over 2.5 lakhs to 10,000 rupees as we move forward. Okay. Now what it does is it gives us the exact genetic makeup of an individual and how it becomes applicable to daily life or health for a person is that if you look at, there are certain diseases which we are struggling with, what we call lifestyle diseases. Lifestyle diseases are mainly diabetes, cancer, heart disease. So in today, there are enough genes that can be identified. I mean, it's changing by the day, that you can actually find the imprint in a person's genetic makeup to see where they are vulnerable for which disease. Because today, there is enough knowledge about heart disease, but the new heart is cancer. And everybody is living in that fear today, is how do I detect cancer at its initial stage, because it's totally curable in most instances. So coupling that with the AI generators of, the data mining, big data analysis in matter of hours or days, which used to take us years, has compressed that whole process, and we can look at the algorithms which, for example, what do we want to know? We want to know if a patient is going to crash within the next 4 hours, 6 hours. So the early warning systems can be now, have already been created in the algorithms. If somebody is going to get severe infection, what we call sepsis, you can predict it happening 4 to 6 hours before today. So there is a huge change in favor of it, but at the same time, it has given the ability to do personalized medicine when you can actually write the what we call Janam Patri is now the health Patri of an individual. And that is a very important movement forward, because you have the blueprint in front of you. Now you may decide to follow it or not follow it and be warned about what you are prone to, but it's there. It's an amazing thing that has happened today. So now we practice medicine in a totally different way, and that is one of the things that we must recognize as physicians, because it's only going in favor of trying to serve the public better.